name's Alexa.
Hi, my name's Eliza, and we're going to be walking you through our assessment tool. We have the Barthel Index of Activities of Daily Living. The purpose of this tool is to be able to see one's abilities within all their activities of daily living. So for example, we do feeding, toileting, bathing, etc. A lot of the times this assessment's used for patients with strokes in inpatient facilities, although it's really tangible, so you could use it anywhere you'd like, which is really great. There's many different versions of this test, so we're going to walk you through the modified 10 version, which is that we look at 10 different activities of daily living, and from there you tally up the score anywhere from 0 to 5, and the highest score can be 20, which means that they're fully independent, and the lowest could be 0, which means that they're fully dependent. All right, let's get started. Okay, so this is an example of the Barthel Index. This is the modified 10 version. So as mentioned before, we're going to look at these specific activities of daily living. So we have bowel, bladder, grooming, toilet use, feeding, transfers, mobility, dressing, stairs, and bathing. Another modified version of the Barthel Index of activities of daily living is the modified 5 version, and that's looking at just specific 5 ADLs. So that's transfer, mobility, stairs, bathing, and toilet use.
For method of administration for this assessment, it can be either administered by skilled professionals, so that can include like OTs, PTs, physicians, doctors, kind of any therapist really, and then by unskilled professionals, so this can either be by family members or caregivers or even by the patient themselves for self-report. And then this can be done via interview, or you can directly do an observation, so have them demonstrate it while you're directly observing them, or by telephone.
Hi there, Alexa. My name's Eliza. I'm the OT. Today we're going to be going through the Barthel Index activities of daily living. So there's a few different ways that we're going to perform and administer this test on you. One is going to be just through the informal interview process. So we're just going to talk about it. And then the other one is I'm going to actually ask you to demonstrate some of it where I could directly observe you. How does that seem?
Sounds good.
All right, perfect. Okay, so the first topic I want to discuss with you is your bowel and bladder movement. So first we're going to start with bowels. So rating that from 0 to 2, 0 is incontinent, 1 is occasional accidents, like once a week, and then 2 is continent. So not an issue, goes to the bathroom by yourself. Where would you rate yourself?
I'd probably rate myself at 2.
A 2. Okay, great, perfect. Now we're going to talk about bladder. So same thing, 0 is incontinent, 1 is occasional accident, so once a week or so, and then 2 is fully continent. You're able to do that all on your own independently.
I would say that as a 2 as well.
Okay, perfect. Okay, now we're going to demonstrate toilet use. So if you're comfortable, would you mind just demonstrating to me how it is that you can get on and off the toilet? Yeah. That's great. Okay, Alexa, now I'm going to ask you to demonstrate your self-care, so grooming, like washing your face, your hair, your hands, teeth, etc.
Okay. So I usually just turn on the water, get the washcloth all wet, dab my face, get some soap, scrub it,
Great.
and then put some water on, and then dry it with a towel.
That's great. Okay, now I'm going to ask you to demonstrate feeding. So 0 is unable to do so. 1 is needs help cutting, spreading butter, etc. And then 2 is independent. So when food's provided within your reach, you're easily able to bring that to your mouth, cut it and prepare it how it is that you would need to.
Okay, so I'm just going to cut this nut.
Okay, great. Okay, now I'm going to ask you to perform for me 3 of the activities of daily living. So one of them is transfer. So if you just wouldn't mind being able to get up from your chair and walk on over towards the door.
Yeah.
Now we're going to focus on mobility. So that's, just being able to get around, whether it is that you use a wheelchair or a walking stick. So how about we walk on over toward the steps?
Okay.
That's great. Perfect. Now, do you mind coming back up towards me? That was great. Would you mind demonstrating for me how it is that you dress yourself? Do you feel that you're able to do that independently?
Yeah.
Okay. Perfect. Now, do you mind going ahead and zipping that for me?
Yeah.
Great. Okay, so now I'm going to ask you about your bathing routine. Do you feel that you're able to do that independently on your own?
Yeah, I would say yeah.
Okay, fine. So then I'll rate you at a 1 where you could do that independently. Okay, now we're going to go ahead and gather up all the scores. So in bowels, you got a 2. In bladder, you got a 2. In grooming, you got a 1. Toilet use, you got a 2. Feeding, you got a 2. Transfers, you got a 3. Mobility, a 3. Dressing, a 2. Stairs, a 2. And then bathing, a 1. Full score is a 20. So that means that you are fully independent.